Greetings, everyone. My name is Christina. I'm the internship coordinator with Santa Barbara City College. And today we are joined by Cope Health Solutions, and they're going to be talking about their wonderful opportunities that they have with the organization. And we're joined by Dana and Virginia. And so I'm going to have you all take it away.
Great. Thank you so much, Christina. Thank you, everyone, for your time. It's myself, Virginia, and we have another colleague on the call, also Lindsay. We're all a team working to really recruit for this program, all of our programs, but our St. John's program in particular. But as you'll see in the slide deck, we have many other locations if there are other locations that do work best for you. So I will go ahead and get started with our presentation. So the Health Scholar program, something to think about, as I go through the deck, is, it's a really good opportunity for individuals who are interested or curious, no matter where you are on that spectrum of, kind of maybe thinking that where you want to go within healthcare, or if you're not even sure if you want to explore healthcare, however you think that you might be able to fit in, in the workforce within healthcare. This is a great way for you to get that experience and that exposure to solidify where it is that you could potentially be, and really just get a great experience, whether you decide you want to go into healthcare or not. I think a lot of us, we kind of fantasize about what working in a hospital or a healthcare setting may be, just based on television and all of that. But this program, the Health Scholar program, will give you a real life look at what it really is like to work in the hospital setting, what it's like to work alongside the patient care delivery team, doctors, nurses, other allied health professionals, as well as what it's like to interact with real patients. So who are we? The Cope Health Scholars program is an experiential learning program. It's one of our workforce solutions that we provide within Cope Health Solutions. It's our program that has been around the longest. We've had this program running in various locations for over 20 years. We still have some of our original programs that we've established with our healthcare partners. They're still running to this day, over 20 years. And I'll be speaking more specifically to our St. John's location in Oxnard and Camarillo. So this is a really good program for individuals who have a passion for healthcare or even the slightest interest in healthcare. It can be pretty daunting, especially if there's no one in your family that maybe works in the field and you're not sure where to start, or even if you have had a lot of exposure and maybe have an idea as to where you might want to go. It's good to get that hands-on experience for yourself. So in the program, you'll get an understanding of the different roles and departments and all of the key players with regard to the hospital and the hospital setting and other clinical areas as well. At St. John's, it's mostly hospital departments. We do have at least one administrative area. And then it is a way in which you can get opportunities to network and grow professionally. We provide webinars and other opportunities for educational awareness and experience outside of just being in the hospital. The program provides you the opportunity to learn how to navigate the hospital setting, but it also prepares you to be a healthcare professional. So we provide a lot of resources with regard to testing, resume writing. You get to hear stories from our alumni and their journey and how they got to their career, so that there are a lot of resources so that you are aware of what it takes to get to various levels and roles within the healthcare landscape. So this slide goes over these are some testimonials from scholars in the program. These are alumni mostly. And, I've been a part of the Health Scholar service line for 5 years. I've run a number of our programs or assisted in some form or fashion. And so, you'll have access to this deck and you'll be able to read through, word for word, all of these testimonials. This is just a snapshot of the thousands of scholars that have gone through this program. that have seen a lot of success, whether it is they wanted to go into healthcare or not. We see it as a win either way. Of course, we want individuals to go into the healthcare setting because we need healthcare professionals, but also it helps individuals know where they want to go, and so they're not wasting time thinking that they, are going to pursue something that, had they had the time to really get that exposure, they'd realize it really wasn't for them. But I think either way, it's a wonderful way to get that clarification. So these individuals and many that I have worked with, during my tenure here at the firm, have really said that the experience enhanced, being a part of the program enhanced their experience in a way in which they see that as they go into their professional program, that they really are a step ahead of some of their peers. I have some leaders, the health scholar leaders that I worked with at one of the first sites that I was a part of, who are now in medical school. And we had an alumni mixer, and I got to see them again, and they told me that they can see the difference between their classmates who have had no clinical experience whatsoever, and understanding the patient experience and what it's like to be a part of a team, when they have had that experience and have gotten to really hone in on those skills. So it's really valuable opportunity. This is just one spotlight of an individual who participated in one of our Washington programs, our program in Spokane, Washington. And Samartha is now in medical school. He was a health scholar, as well as he decided to take another role within the program, essentially, and became part of our leadership team at that site. So he was shifting on various units, which we'll go over later on in the deck, but then he also wanted to give back to his peers and help train them, provide them with resources so that they are prepped and ready and have an optimal experience while they're in the program. So Samartha said that he found that learning about other stories and understanding his community helped him while he was pursuing medicine. There are a range of patients, but the opportunity to learn how to work with a variety of patients will serve me well in the future. I found that I learned just as much from the patients as I did from the staff. The patients bring a perspective of how they live with their medical conditions. This information will give me a better understanding of how to provide care for my patients in the future. The idea of the program is that, you are a part of your community. You come to whichever program you like to be at. Of course, we'd love you to be a part of St. John's, and you will interact with patients and staff who are from the community, and you can have a better understanding of, who they are, how they operate, and be able to communicate with all different types of people and understand the needs of the patients and how to help provide for those needs. So here's a who, what, where of the Health Scholar program. So Health Scholars are typically students. I know you all are students, but it can be, a Health Scholar can be anyone who is 18 years of age or older and looking to get experience within healthcare. We have an enrollment process, so you can apply, interview, which we see as professional development, and then go through our health screening process, which just allows you to be compliant to operate within the hospital. And then we'll train you 30 hours of training so that you are prepped and ready to actually provide hands-on patient care to the patients and work alongside the staff. So the program has a minimum 280-hour commitment, and you can fulfill this commitment in various what we call program tracks, and that really is just the amount of time in which you would like to take to complete the program. What our standard track is our 15-month track, and that is a 1 4-hour shift. So you'll be on a department unit once a week for 4 hours every week, and you would complete the program in about 15 months. If you're looking for more accelerated tracks, we do have 2 other options. Our 9-month program, where you would shift in 2 departments at the same time, simultaneously, so that's 8 hours a week, and you complete in about 9 months. And then our 3-month program, which is our most accelerated track, and that is about 4 to 5 shifts per week, so about 20 hours of support, and that's all in about 3 to 5 different departments all at the same time. So a lot of experience all at once. Different individuals choose these various programs for different reasons. Some people need the minimal commitment of the 15-month program because they have school or work. Some individuals really like the 9 and 3-month program because they have less time to be able to commit. They want all of the experience, quickly. Maybe they're going to apply to professional school or something. And so those options are available. We don't automatically graduate you. So you need at least 280 hours to be able to be eligible for our certificate of completion. However, you can be in the program for as long as you'd like and shift in a number of departments, if not all of them if you wanted, so that you can get that wide breadth of experience. And you would let us know when you're ready to complete the program, and we would compile all of your hours and get your certificate ready as you graduate. The program provides firsthand healthcare experience, so you will be working directly with patients. And so that's why we have our training so that you are prepped and ready for that. So it really goes above and beyond other like volunteer programs where the scope is pretty limited. There is more that a health scholar could do on a hospital unit to gain that experience. You would be a part of the organizational initiatives that we have at St. John's. We do a few different things. Patient experience is huge, so there's rounding, intentional rounding that is done on patients to make sure that their experience is as optimal as possible. We also have stroke education rounding, so going around to patients and providing education on the signs and symptoms of stroke. And then we also have another initiative such as a meal tray delivery to ensure that patients are getting their food timely and getting assistance with obtaining their food as needed. And as I mentioned earlier, we do provide professional development. We can help connect you with entry-level jobs if that's something that you're open to, looking for work. Maybe if you're not licensed in healthcare, there are other roles. There are so many roles within the hospital. So you'll be able to network and get to know the setting and see, if there's an area that you might be interested in working in, if that's something that you have that's top of mind. And develop healthcare leadership. So as I mentioned before, like Samartha, when I was talking about him, we also have a leadership program built in internally to the program where you can obtain leadership skills and help essentially run the program and work alongside your peers and coach them through the program as well. And at St. John's, we have inpatient clinical units, and we have one administrative unit, employee health currently, but most of our departments are inpatient clinical units, which means that they don't close, and so you have a lot of availability to pick up, to schedule your shifts. So we offer shifts from 7 a.m. to 11 p.m. Monday, every day of the week. So even on the weekends. So there's a lot of flexibility in which you could fit this program into your schedule. So the prerequisites, being 18 years of age or older, going through our health screening and background process, having a high school degree or GED, and then having active health insurance throughout the program. This slide is an overview of the Health Scholar scope. We like to consider it our stoplight diagram. So anything that's in green, and this is not the full list of the scope, this is just a snapshot. Anything in green is anything that a health scholar can do where staff is not required to also be present with you. So you can do these things independently. Greet and assist visitors or patients, round on patients, answer call lights, and if you could assist with the ask, you can assist. If you need to escalate something to the staff, you can do that as well. And then promote floor initiatives, like some of the ones that I mentioned before. The yellow area is where staff approval is required, but their presence is not required. So you'd want to just ensure that staff know that you're doing some of these things. They'll here at St. John's, the program is well established where the staff know that the scholars can do these things, so they will usually come and ask if you can assist with some of these things. Things such as discharging patients, ambulating non-fall risk patients, taking patient vitals, not so much on the hospital units, but if there are special projects or other opportunities, you are able to do that, but you're trained on taking patient vitals and feeding patients. The next area, the orange section, is where staff presence is required. And these are typically tasks that require an extra set of hands. So you'll get approval from staff. They may ask for assistance for some of these things. So you'd be doing these alongside another staff member. Assisting a patient with daily patient care activities, things like bathing, toileting, repositioning, and then observing procedures, just depending on the unit that you're on. You may be able to observe certain procedures. And then we have restrictions, and those are things that are totally outside of scope that you're not able to do. One of them being translating or interpreting clinical information. So that's just clinical information. If you speak another language or a language that a patient speaks, you can converse with that patient just for patient experience purposes, make them feel comfortable, and ensure that you will enhance their experience. But when it comes to any kind of medical information, that can't be translated. No handling of medication or acting as a sitter, and no ambulating fall risk patients. So our enrollment process. I kind of touched on this earlier, but this slide takes us through enrollment into completion of the program. So first, you can apply, and I'll have the link in the deck later on. So we have an application that really just asks for basic demographic information, as well as a few short answer areas, just so that we can understand why you're interested in being a part of the program. And then once that's reviewed, we would call you in for an interview. And then upon passing that interview, we would move on to the clearance phase. And that is a health screening. So there's various records that are needed, a lot of vaccinations that are probably childhood vaccinations, as well as some other requirements, and then a one-time program fee. We'll talk about the fee later on. And then you'll be invited to training. You will receive access to some online modules that you can review on your own, and then you'll come in for an in-person training day where we will review skills and concepts, and then you'll also be tested on those skills and concepts. Upon passing the training, you will then be assigned your first unit, and you will have a department-specific training, so you'll know exactly what you need to do on that unit. So you'll be prepped and ready to be shifting your 1 4-hour shift per week on that unit. You'll be on that unit for about 3 months, and then you'll be able to go on to another unit. Now, if you're in the 9-month program or the 3-month program, you'll be in multiple units at once, but the same practice applies, where you would be in how many of our other units you're assigned to based on your program track, and then every rotation you'll be able to move into different departments. Then, when you receive a minimum of 280 hours, or whenever you're ready to graduate from the program, if you go above and beyond, then we will have you apply for graduation, and we'll provide you a certificate of completion from our academic partner, Kent Graduate Institute. This is an example of the departments that are available at St. John's. So we use what we call a tier system. So if you look at the bottom, that's your tier 1. So after you've completed your training, you would be deployed on one of our medical surgical units, or our DOU, ACU. Essentially, these are like our nursing units, where the idea is you've gone through all of this training, and you should be utilizing a lot of those skills that you learned in your training on those units. So you can master them, get very comfortable with being on the hospital unit, so that that's your foundation as you go up in tier to the other units that are of higher acuity, more sensitive patient population, being able to observe various procedures and things like that. So as we go up each rotation, let's say we're in tier 2, we have telemetry units there, and then we go up to the next tier, we have emergency department, mother infant unit, and radiology. Tier 4, labor and delivery, and ED shadowing. And ED shadowing is where you work directly with physicians from the emergency department. So that's why we require you to go through the emergency department first. But it is a good way to network and really get to work alongside the physicians there. And then at the top of our tier system, we have the neonatal intensive care and the operating room. So, definitely areas where, the sensitivity of the patient is pretty high. So we want to make sure that our scholars have had a lot of experience before they go onto those units. So this is a snapshot of some of our locations, or all of our locations in California. Of course, I have Dignity St. John's at the top because we would love to have you join here. But I put some other programs that are in the general area as well, maybe not too far. I know Oxnard is probably the closest one to you all, but there are other locations here. And then we have locations in different states as well. I even call this out just in case some people are moving. We have people transfer from program to program, state to state. So I like to put all the sites that we have just in case you might be relocating. Okay, so our program fee, we do have an application fee of $21. I can see if I can get a waiver code and maybe send over to you all so that you can waive that if you're really interested in applying. This is our, this month, the 23rd is the cutoff for our next enrollment cycle. We're always accepting applications, but we have to kind of make a cutoff to then prep everyone for our upcoming training in January. But we do have one-time program fees for all of the programs. For our 15-month program, it's $295. Our 9-month program is $475, and our 3-month program is $595. Again, this is a one-time fee, and this really goes to help with the facilitation of the onboarding and enrollment and the certificate with our academic partner. That's really what a lot of that goes toward. We will provide assistance as needed. We never turn anyone away for the program if they are unable to pay. So please just reach out. I would say start the process. If you're really interested, just start. We want to see that people have that interest and will, kind of start the process and go through the process. And we can have conversations as needed, but we never want this to be a barrier. It's just a way in which helps us facilitate enrollment into the program. We have an Instagram. Our St. John's location falls under the West LA Health Scholars. So please follow us on Instagram. You'll get a lot of updates, updates on deadlines and information about the program, and also information about fellow scholars and spotlights and alumni and all of that. So just, you'll get a lot of information about the program. And so here at the top is the link to apply. It's copehealthscholars.org/apply. And then we also just want to remind you again that our deadline is the 23rd. So we're hoping to see your applications come through. We are always accepting applications. So please apply no matter when it is that you are viewing this presentation. But for our current rotation, we will be starting to review apps and grading applications after the 23rd. But we are always accepting applications, and we are having essentially monthly trainings at this point to really get our scholars engaged and enrolled into the program. And that's the end of our presentation. Thank you so much.